Hello everyone, my name is Mia Smith. I am a project manager at Alpha Cytology. Today, I am excited to walk you through the essential principles, techniques, and the methodologies. I will also share a little bit about Alpha Cytology's role in the second part of this talk. So let's begin with the building principles of animal studies. The 3R principles: replacement, reduction, and refinement. These three concepts shape all aspects of our research. Replacement encourages us to use alternatives to animal testing whenever feasible, such as in vitro models or computational simulations. However, in areas like cancer research, animal models often remain the best way to simulate complex biological processes, allowing us to observe a therapy's effects on an entire organism. In these cases, we move to reduction and refinement. Reduction emphasizes using the minimum number of animals necessarily to produce statistically valid results, avoiding waste and unnecessary impact on animal lives. Refinement involves enhancing methods to reduce discomfort and stress for the animals, ensuring that even in the research setting, we prioritize their well-being. By embracing these principles, we aim to balance scientific progresses with ethical responsibilities. This is our commitment that guide every single project at Alpha Cytology. When it comes to designing a study, setting clear objectives and hypotheses is the critical first step. Knowing exactly what you aim to achieve may seem straightforward, but well-defined goals can significantly impact the direction and the effectiveness of your study. For example, your objectives might range from investigating a drug's impact on tumor growth to evaluating its effects on metastatistical potential. Defining these goals early on allows us to tailor the study design to meet the specific outcomes. Now let's dive into preclinical model selection, which is one of the most impactful choices in study design. Choosing the right models can determine the successful study, as each model type has its own unique strengths and limitations. The properties of clinical versus preclinical models vary significantly, as each offers unique insights. Cell line-derived xenografts, or CDX model, are some of the most common tools in preclinical research. However, these models are valuable for evaluating mechanisms like drug resistance or toxicity. They don't always predict clinical outcomes accurately. This is mainly due to their simplicity. CDX models often lack the complexity and the heterogeneity seen in human tumors. For example, cells that have been cultured over a long period tend to diverge from the genetic and phenotype characteristics from the original tumor. This divergence highlights a key limitation. The longer cancer cells are cultured, the further they deviate from their original form. However, despite its limitations, CDX models remain valuable because they are efficient and cost-effective, especially when we are screening for potential drug candidates or evaluating non-targeted cytotoxic agents. On the other hand, we also have models that aim to bridge the gap between preclinical findings and clinical realities. Models that are more clinical relevant often require more complexity, but also offer greater predictive values. One prominent example is the patient-derived xenograph, which is a PDX model. The PDX model are gaining popularities in research recently. PDX models involve transplanting human tumor tissues directly into mice, preserving the tumor's genetic characteristics and heterogeneity. This allows PDX model to more accurately reflect the human disease, making them invaluable for translational research. Choosing between these models require carefully consideration of your study goals, timelines, and the specific cancer type that is being studied. Another factor always to remember is while models mimic human disease, they don't always replicate this perfectly. Biological variability is inherent in any models, whether it is due to differences in age, gender, genetic background. For this reason, it is often necessary to use multiple models to validate findings. Testing on various disease models allow us to cross-verify results and observe potential differences in response, helping us building a more comprehensive picture of a therapy's effectiveness. Design strategies are fundamental to reliable results. By applying randomized techniques, we reduce bias and enhance the statistical power. To maintain objectivity, we also use blind protocols in both measurements and analysis. In controlled groups baselines, proper setup of control group is crucial. We include vehicle control, positive control, and the potentially untreated group to establish a robust baseline. Tracking metrics such as tumor volume, weight, survival rates from the outset allow us to accurately observe treatment's effects over the time. Statistical consideration form the core of our analysis. Determining an adequate sample size through the power analysis ensures our results are statistically sound. We apply specialized statistical methods to examine the tumor growth inhibition and the survival curves. When evaluating combination therapies, our approach goes beyond the traditional analysis by incorporating linear mixed models to handle clustered longitude data, addressing both intra-tumor and inter-tumor variability. This advanced framework provides deeper insights and more accurate conclusions. When setting sample sizes, we aim to balance statistical power with biological representation. A sample size that is too small may lead us to miss meaningful differences, while a sample size that is too large could result in unnecessary use of resources and risk ethical concerns. To find this balance, researchers often conduct a power analysis. Typically, this power analysis targets a power of 80% and an alpha level of 0.05, which gives us an 80% chance of detecting real differences between treatment and control. This calculated approach minimizes the variability, especially when working with human donor cells, which can introduce unique differences across experiments. By choosing a sample size that is scientifically and ethically justified, we enhance the reliability of our findings, reduce the risk of drawing incorrect conclusions. In addition to sample sizes, another critical factor is dose selection and administration routes. Dosing in preclinical studies isn't just about determining how much of a drug to give. It is about choosing the right balance between efficacy and safety. This involves determining the maximum tolerated dosage, which is the highest dose that an animal can safely tolerate it without severe side effects. We also look at PK and PD to understand how the drug behaves in the body, how it is absorbed, distributed, metabolized, and ultimately how it is interacted with its target. Deciding on the route of administration, whether it is intravenous, oral, subcutaneous, or intraperitoneal, is equally important, as it affects the drug's bioavailability and overall effectiveness. Selecting a proper administration route ensures that we're studying the drug in the way that is relevant to the future clinical use. When it comes to evaluation parameters, we have several tools to measure the therapeutic outcomes accurately. Tumor growth, for instance, can be assessed using traditional measurements, but we also employ advanced techniques such as bioluminescent imaging and MRI, both of which allow us to monitor changes non-invasively. These imaging tools offer precise insights into tumor progression, let us observe changes in real time. Alongside tumor growth, we monitor for toxicity, looking for indicators such as weight loss, behavior changes, and organ health. Such metrics are essential in understanding not just whether a therapy works, but also how safe it is. We also use Kaplan-Meier survival analysis to evaluate therapy's impact over the time. To sum up, reproducibility in vivo studies depends on a range of factors. Setting clear goals, understanding the mechanism of cancer, maintaining rigorous animal health standards, and employing a robust statistical framework. Each of these elements plays a role in producing high-quality, interpretable data that can guide clinical applications. At Alpha Cytology, we are committed to ensuring that every study we support follows these standards, generating results that drives meaningful progress in the cancer research. Now, let me tell you a little bit about Alpha Cytology. Our facility is a nearly 14,000 square foot, two-story building located in Long Island, New York. It includes 50 office spaces, 2 warehouses, several lab spaces staffed with a team of over 50 employees, many of whom withhold PhDs from accredited universities. Our team comprises experienced scientists, bioinformatics experts, and professional oncologists, all dedicated to advancing cancer research. We provide a seamless experience that spans the complex stages of target discovery through to IND filing. Our business model is constructed to be flexible. We offer fee-for-service models as well as platform license options, depending on your needs. In the term of capacity, we operate across 3 cores: drug and biologic discovery, preclinical development, and IND filing support. This end-to-end capability allows us to support our clients at every stage of the development progress. Our one-stop solution for cancer preclinical research involves a comprehensive path from idea to IND, covering every critical stage of drug development. We start with target discovery, where we leverage advanced tools such as siRNA, mRNA, protein expression, biomarker analysis, etc., to identify potential therapeutic targets and understand the key signaling pathways. Next is hit identification. This includes AI-guided hit design and a suite of assays such as target-specific enzymatic assay, 2D and 3D cell-based assay to screen and validate promising compounds. We also conduct in vivo efficacy evaluation to ensure that these hits showing potentials in biological contact. In lead optimization, we focus on refining the hits for enhancing efficacy and safety. This involves functional analysis, selective analysis, mechanism of action studies. We also perform PK/PD studies to fine-tuning each candidate's profile for maximum effectiveness. Finally, IND enabling. We conduct efficacy evaluation alongside in vitro ADME and in vivo DMPK studies to understand absorption, distribution, metabolism, and excretion profiles of our candidates. Toxicology evaluations are also performed to ensure safety standards are met before progressing to the clinical stages. Our project management team is dedicated to support preclinical product design and manage research progresses to ensure an efficient and development progress. We aim to accelerate timeline and expedite drug development by our optimized study strategy. The project management process begins with project design, where we establish a clear and comprehensive plan tailored to your project requirements. We then set a project timeline to ensure the timely progress. Coordination with subcontractor is another key step, allowing us to manage all external resources effectively. Finally, we handle data collection and results analysis, ensuring that accurate and high-quality data in compliance with global standards. Our advantage lies in three areas. First, our customized research plan ensures we provide multiple study design options to meet your requirements. Second, dynamically results discussion allow us to rigorously and scientifically monitor project progresses and adjust the strategies as needed. Lastly, seamless communication with clients are maintained throughout to keep everyone aligned and ensure milestones are met on schedule. With this construction and responsible approach, our team's expertise helps overcome challenges and avoid missteps in the drug discovery process, ensuring both efficiency and compliance. Thank you for your time, and I look forward to work with your project. Please contact us at this contact information below. Thank you so much.